Hi, my name is Chris Grimes. I'm a lab tech at the Health Partners Inver Grove Heights location. We have been hearing from some members that feel like all our updates are about changes management would like to make to our healthcare benefits. We would like to give a more detailed explanation as to where we are in our negotiations. So today, January 22nd, 2020, we would like to report where we sit. I will start with proposals that management has made, but we have successfully pushed back on and have ultimately been dropped. Reassignment language, increasing our acceptable travel from 16 to 30 miles, multiple bid restrictions for posted positions, changes to ILS, involuntary leave status, including eliminating the 2-hour notice, removing restrictions in place so management can use ILS for any reason, modifying language to the amount of time in reporting periods. Also, they've requested modification to VLS, voluntary leave service, for modifying the language for the amount of time in reporting periods. The ability for supervisors to create a flexible FTE position, changes to the rate of pay when changing your position to a new classification, adding restrictions to how and when we bid for vacation, eliminating our doctor time provision, modifying language to reduce our education benefits for part-time workers, and adding the number of working supervisors. Again, these are all items management had proposed and we had successfully pushed back against. Of course, in order to do this, we need to drop some of our own proposals that management have said no to. These are additional compensation when we are reassigned, increasing our education fund, increasing our personal holiday hours, modifying language so that Christmas Eve would be a full day holiday, increasing from 3 to 4 hours for doctor time, modification to our bonus shift payment, increase in our life insurance plans, and also addition of retiree medical and dental plans.
Hi, my name is Becky Van Dickel. I'm a certified ophthalmic technician working at the 401 Phelan Specialty Center. So I'm going to go over some of the things that we have accomplished so far in negotiations. So some departments have been wanting to change their vacation bidding to maybe perhaps bid more than twice a year. There's now a letter of understanding that if your department would like to do that, that's something that's available to you. Legal guardianship has also been added to the list of available family members that you could use your sick leave time for. Although we were not able to add aunts, uncles, nieces, and nephews to bereavement leave, we do have that language now in the VLS section for voluntary leave status, so that's an improvement. We've also been working hard to increase the availability call pay from $3 per hour up to $10 depending on your wage scale. The electronic records for HR will no longer be available to get a paper copy of any disciplinary action you'd like removed from your file. There's other things still on the table that we are working hard for, but we have to come back and revisit. One of those is we're working hard to get an extra day of vacation for employees who have 25 or more years of service. Also, some sick leave payout time for retirees who have more than 1,250 hours of banked sick leave. We're also trying to get increased longevity pay for all employees. And we're fighting back against the employer who's trying to take away our daily overtime pay and doesn't want to pay overtime unless you work more than 40 hours in a week. There are other issues we haven't yet really talked about, but are still on the table. We're working hard in negotiations to increase shift differential across the board. Also to change the sick leave incentive that would be more beneficial for employees. Our economic proposals such as wage increases and the changes to our healthcare are still on the table. We haven't really talked about that. If you want more information about how the healthcare changes could impact you, please visit SEIUhealthcaremn.org. There's a link for HP bargaining, which will open a calculator and you can input your own information to see how impactful that would be for you and your family. This has been a really slow and tedious process, so we appreciate everyone's patience and we appreciate your support as well.